Good morning once more. Today we'll look at anatomy of the pelvis and then the perineum. So these two parts, I should have done abdomen, but we'll look at that later. So we'll look at the pelvis and then the perineum. Now, when we talk about the pelvis is the lowest part of the abdominal cavity. Okay, so when we take the lower part of the abdominal cavity, it distends down, and then below the pelvis, where we have the genitals hanging, is the perineum. So today we'll be looking at the pelvis and then the perineal anatomy. So when we talk about the pelvic cavity is actually enclosed by a bony and then ligaments and then a muscular wall. So it is a cavity that is having bone connections that are enclosed by ligaments and then also have muscular wall. Then within this pelvic cavity, we can see the urinary bladder, the ureters, the pelvic genital organs. So at the region of where the pelvic genital organs is where we call the perineum. The rectum, some blood vessels, lymphatives, and nets. So this pelvis is demarcated into two parts. We have the pelvic inlet and then the outlet. So let's look at how this structure look like. So this is the pelvis, which is made up of this bony substance, which is the sacral vertebrae. Then we have the left and then the right coccyx. So we have the right and then the left coccyx, which are met anteriorly by the pubic symphysis. And below this pubic symphysis, we are having the ischial tuberosity. These things we are well conversant with them from last semester's discussion. Then we realize that this pelvic cavity creates an inlet. So this is the inlet. This is the superior aperture, which is known as the superior inlet, which is demarcated by the bones of the sacral vertebrae, the left and the right coccyx, and then the pubic symphysis joining the pubic bones. Now you note from the earlier semester that this bone, which is the coxa or the pelvic bone, is made up of three bones combined: the ilium, the pubis, and then the ischium. Now the pubis and the ischium are kind of connected anteriorly by the pubic symphysis, whilst posteriorly the coccyx are connected to by the abdomen. So this is the pubic cavity or pelvic cavity. Please, can we see the screen anyway? Hello, can we see the screen?
Yes, sir.
Yes, sir.
Yes, sir.
So when we take the pelvic cavity, we have where the sciatic nerves will pass. We'll be looking at all those things. And then the obturator canal. So we have some plenty foramens within here. We have the great sciatic foramen and then the lesser sciatic foramen. And then it is just a ligament that separates the great sciatic foramen and then the lesser sciatic foramen, which we'll look at very soon. And then behind, so at the back of the pelvic cavity, we have a lot of ligamentous structures that are holding this part very well. That is why when footballers begin to have pains around here, then that means that there's so much stress in the ligamentous substance. And because ligaments are very difficult to heal or takes a longer time, that is why when anybody goes on pelvic injury, it takes a longer time for the person to heal and come back to play. And this is the inferior pelvic border, which is made up of, we can see the urethra. So below this pelvic border, this is the border. So above it, we have the pelvic cavity. So below it now, we are looking at the perineum. That's one thing I want you to know. So we are looking at the urethra, the vagina, and then the anus. And this tells you this is a female perineum, and then on top of it, we'll have a female pelvic cavity. So what we are seeing here are muscular substances that divides the pelvic cavity and then the perineal cavity. So the ligamentous structure that holds the sacral vertebrae in conjunction with the coccyx is known as the sacrotuberous ligament. Sacrotuberous ligament. That means it's coming from the sacrum and also kind of attaching to the tubular substance of the coccyx and then the humerus as a whole. So this is what holds the whole pelvic cavity in place. Now listen, the gap between the pubic symphysis and then the perineal membrane, okay, that is the inferior pelvic bladder. So that's the gap between the pubic symphysis, this is the pubic symphysis, and then the perineal membrane is somehow where here, and this whole place will be the inferior pelvic border, and below it we have the inferior or the perineal cavity. So all these things, they are just trying to show us how the nerves will go in. So this is the lesser sciatic foramen, just below this sacrospinous ligament, because it's going to the spine of the coccyx. So we call this one the sacrospinous, but this is the sacrotuberous ligament. And then so this sacrospinous ligament will divide the sciatic foramina into greater and then lesser. So the bony pelvis is actually formed by this innominate bone, which is made up of the ilium, ischium, and the pubis. That's the coccyx, the sacrum or the sacrum, and then the coccyx. Now, these bones are joined anteriorly by the pubic symphysis and posteriorly by the sacroiliac joint. And this is just to show us the sacroiliac joint. This is the sacroiliac joint, the joint between the sacrum and then, so this is just to show the better over here, sacroiliac joint. And then this is the promontory of the sacrum. And then this is the imaginary line of the outer or the pubic inlet, that's the superior aperture. And then this is to show us the obturator foramina. So this whole place is the sciatic foramina, which is divisible, which divides into greater and lesser sciatic foramina. So predominantly, we are looking more at the female pelvis, which is a bit wider than the male pelvis and a bit more circular. And then the angle here is about 80 to 85. So that is the difference between when you do your fingers in that manner, that will be the angle that we find around this area. So like this area, that is more circular. We'll be seeing how the male pelvis also look like. So you can see that this is more wider because inferiorly, we have the pelvic bladder, which contains the vaginal orifice, and the baby will be passing here. So we need a more space here to allow for those things to happen well when we take the pelvis inlet. Now, when we take the male inlet, we can see the inlet, which is a bit more oval, not a round as this is more oval, and this is kind of I don't know what kind of shape I'll say. So you see that that one looks more like this, the angle that is 50 to 60. So the angle here is about 50 to 60, but for female we are having 80 to what, 90. So that is how the bones are formed here. So we don't have enough space when it comes to the pelvic girdle, and it's like a heart shape. It's like a heart shape, and this one is more circular. Sorry. So this is more like a heart shape. We can see it over there, down there. Now, so the pelvis actually begins from the anterior superior iliac spine. So if you forget your pelvic anatomy last semester, please go and revise all the way through the pubic tubercles and then come to the pubic arch. So this is what is going to form the pelvis. So the whole pelvis is, when you see your pelvic bone and everything together with that, they form the pelvis. Now, the pelvis is divisible into pelvis major and minor, or the greater pelvis. The greater pelvis is a location for some abdominal viscera. So we can talk about the ileum and then the sigmoid colon. They can be found mainly in the greater pelvis. And then it is bounded by the abdominal wall anteriorly. So anteriorly, we should be seeing the abdominal wall, which bounds the greater pelvis. Then the iliac fossa will form the boundary posterior laterally, and then the L5 and X1 vertebrae will form the posterior boundary, the posterior boundary. So this one is a bit above the pelvis, okay, a bit above the main pelvis. So we call that the false pelvis. Then the lesser pelvis, or the pelvis minor, that is where we actually have the main pelvic cavity. So we have the location of the pelvic viscera, where we have the urinary bladder, and then we have the reproductive organs, such as the uterus and the ovaries in the females. And then this pelvis minor is bounded by the pelvic surfaces of the hip bone, that and the sacrum, and then the coccyx. Then they are limited inferiorly by the musculofacial pelvic diaphragm. So where I was showing you earlier, showing you the three divisions, the vagina. Let me see if I go forward, if you'll see that. This part. So this is what we are talking about, that will bind it inferiorly. So this is actually the true pelvis. So that muscle we saw there is known as the pelvic diaphragm. Now we will take the anterior pelvic walls. So we're looking at the anterior pelvic walls. We are looking at the pelvic walls, and they are the floors. So the anterior pelvic wall is formed primarily by the bodies and the rami of the pubic bones, and then the pubic symphysis. So anteriorly, we should be seeing the pubic bones and then the pubic symphysis. Laterally, it should be formed by the hip bone, that is the coccyx. And then we should look at the obturator internus muscle. Okay, the obturator internus muscle. And then this O and I. Who can tell me what the O and I means? That's the point of origination and the point of insertion. So we are just trying to tell us that the obturator internus muscle will originate from the proximal surface of the ilium and the ischium, and then insert on the greater trochanter of the femur, on the greater trochanter of the femur. So this is just to show us the anterior pelvic wall. So when we take the anterior pelvic wall, this is the obturator internus muscle. And if you did remember, this is a muscle that will form the lateral pelvic wall. And then the pubis and then the pubic symphysis, okay, are going to form. So this is the ischium. Okay, this is the ischium. And then this is the obturator internus muscle. And then this is the sacrospinous ligament. So there is the piriformis muscle. And then these things are trying to show us the anterior border of the pelvic wall. Now, when we take the posterior pelvic wall, it is actually by the sacrum and the coccyx. That is where what we can see at the posterior pelvic wall. Adjacent to the posterior pelvic wall, we can have the ilia. They also form some of the walls or the boundaries there. The piriformis muscle also covers the posterior pelvic wall. And then this muscle actually have a point of origination at the second and fourth sacral segments, and also superior margin of the greater sciatic notch. And then I hope you remember all these things I'm mentioning because they are on the pelvis. And the sacrotuberous ligament. 8 point of insertion will also go to the greater trochanter of the femur. So all that we are trying to say, we are looking at the posterior pelvic wall, okay, which is mostly formed by the sacrum, okay, mostly formed by the sacrum. First, we were looking at this side. Now you are looking at this side. So the sacrum, and then the piriformis muscle also come back there. And then this is the iliac spine. So this ligament will be the sacrospinous ligament because it's coming from the sacrum. Okay. I don't know if you can see this well. This is the one end of the sacrum and this is the other end. So the whole sacrum is like this. This is the coccyx. So you can see how it's bent, like tilted a bit. So this is the sacrum, the coccyx, and then this is the sacral vertebrae. This is the promontory. So this side actually forms the posterior wall of the pelvic girdle. Now, at this point, this top on this point and above, that's what we are calling the false pelvis. And then anything within here is what we call the true pelvis. And then they are just trying to show us the lumbosacral plexus and some of the nerves that will be formed from the lumbosacral plexus. What's happening? So next thing we look at is I don't know why my thing is not showing. We look at the pelvic floor. I think let me just stop share and then pause for a minute and then reproject. Please, can we see now?
Okay.
Please, what can you read right now?
Pelvic floor.
Okay, all right.
Point 1, followed by the canal.
Okay, thank you. So we are at the pelvic floor. So if I will just 1 minute take you to the whiteboard. Let me just take you to the whiteboard a bit to explain what I'm trying to lecture on. So it's like we have this, this is the sacrum, which goes all the way down there. And then we have the
pelvic floor.
the ilium. So these are the ilium. So anteriorly, this ilium, we call this part. So this is actually forming the posterior border. Now, anything, I wish I could have drawn this thing in 3 dimensions. But if I'm drawing the sacral vertebrae in this way, so this will continue in that way. And then the ilium will also be at this area. The ilium will also be at this area, and another one also here. So anything above the sacral vertebrae is what we call the false pelvic cavity. Anything within here will be the true pelvic cavity. Now let's go back to the main lecture slide. So we are saying that the floor of the pelvis is actually formed by the funnel-shaped pelvic diaphragm. And this funnel-shaped pelvic diaphragm consists of a muscle called Levator ani muscle and the coccygeus muscle, and then they have fascia. So we have the Levator ani muscle, and then the coccygeus muscle, and then they have fascia. And then this muscle will stretch between the pubis, which is anteriorly, and then the coccyx posteriorly, and form one lateral pelvic wall to the other. Now, within the pelvic floor, we should be seeing some nerves in there. I showed you one earlier, the pudendal nerve, which originates from the sacral plexus, lumbosacral plexus. So the sacral plexus will give nerve informations to the pelvic muscles, and then the viscera within the pelvis, and also the perineum. Now, the posterior pelvic wall on the anterior surface of the piriformis muscle also receives information from this sacral plexus. But how is this formed? So we have the anterior rami of L4 and L5, then S1 to S4. They will form the lumbosacral plexus. So the L4 and L5 will form the lumbosacral trunk. And then the pudendal nerve, which is coming from S2 to S4, will leave via the greater sciatic foramina within the Alcock's canal. You see those things very soon. And then the inferior to the piriformis, it will pass, the pudendal nerve will pass inferior to the piriformis, and then it will pass into the lesser sciatic foramina. Okay, now one thing we have to know is that Alcock's canal is very important for the pudendal nerve block. Please, can you see my screen?
Yes, sir.
Yes, sir.
Okay, and is the this thing clear? The speech, is it clear?
Yes, sir.
Okay. Now, what we have to also know is that the Alcock's canal is one important place for the passage of the pudendal nerve. The passage of the pudendal nerve, that is the Alcock's canal. Now, that Alcock's canal, tell what's his name? Chronicles to mute his mic. So the Alcock's canal is inferior to the rectal nerve and dorsal to the penis. It gives dorsal nerve to the penis or to the clitoris, and also forms the perineal nerve, which will give rise to this, go and innervate the piriformis muscle. So let's look at the sacral plexus in a whole. So the sacral plexus will leave the pelvic through the greater sciatic foramina. Okay, the greater sciatic foramina. And then it will form the sciatic nerve, which will have L4, L5, S1 to S3. And then this will branch into this superior gluteal nerve and inferior gluteal nerve. And it will also give rise to the obturator internus muscle and nerve to the quadratus femoris. So these are the nerves that will eventually innervate these muscles within the pelvic floor. And then the posterior cutaneous nerve of the thigh too. So the branches of the pudendal nerve supply most of the perineal structures. And when we say perineal structures, we are talking about the genitals and things. So this nerve arises from the second, third, and fourth sacral segment of the spinal cord. And then the superficial branches will supply the labia majora and then the external genital structures. The deep branch of the pudendal nerve will supply the muscle, the vestibular bulb, and then the clitoris of the female perineal section. Other nerves that comes are the ilioinguinal nerve, okay, or the anterior labial nerve. And then we also have the genital branch of the genitofemoral nerve. And then we also have the perineal branch of the femoral cutaneous nerve. And then we have the perineal nerve, posterior labial nerve. So all these things are just branches of the pudendal nerve. So we mentioned the superior gluteal nerves. So from here, we said the superficial branches will supply the labia majora and external genital, while the deep branches will supply this. Now, we are moving on to the gluteal nerve. So the first nerve we saw, we moved from the pudendal nerve, and then we also talk about the piriformis nerve, and then we came to look at the superior gluteal nerve, and then the inferior gluteal nerve. So we are taking the superior gluteal nerve. We say the superior gluteal nerve will innervate and supply the gluteus minimus and the gluteus medius. And then it also arises from the posterior divisions of the anterior rami of the L4 through so the L4, L5, and S1. The inferior gluteal vessels will also be supplied by the, let me take this again. I think I made a mistake saying this. What I'm trying to say is that the vessels, the blood vessels within that place are innervated by the gluteus medius and gluteus minimus. So these superior gluteal vessels will supply blood to gluteus minimus and gluteus medius, whilst they are being innervated by the superior gluteal nerve. Okay, that will arise from the L4 to S1. While the inferior gluteal vessels are also innervated by the inferior gluteal nerve, which arise from the posterior divisions of the anterior rami of the L5 through to S2. So look at the difference. Superior L4 to S1, inferior L5 to S2. And then these gluteal vessels innervate and supply the gluteus maximus, the gluteus maximus. So the gluteal nerves are responsible for supplying the gluteal muscles. That is the gluteus maximus, the gluteus medius, and the gluteus minimus. The nerve that will supply, the nerve supply to the perineum originates from these three main sources. We mentioned them earlier: the pudendal nerve, the genitofemoral nerve, and the perineal branch of the posterior femoral nerve. So these are the nerves that will supply the contents of the perineum. So now let's look at, we are done looking at the nerves. Let's look at the pelvic diaphragm. The pelvic diaphragm. So this is the pelvic diaphragm, okay, which actually forms the border between the pelvic cavity and the perineum below. So it is made up of this levator ani muscle, and the levator ani muscle is made up of the iliococcygeus muscle, that means coming from the ilium to the coccyx, okay? And then we have the pubococcygeus muscle, pubococcygeus, okay? We have the pubococcygeus muscle, and that is this one. I mean, coming from the pubis of the coccyx or to the coccyx to the coccyx of the sacral vertebrae. And then we also have the puborectal muscles. That means coming from the pubis and getting to the anus area. So that is this one. And this is the one going there. This one will go to the coccyx. So these three muscles make up the levator ani muscles. And then these levator ani muscles form a majority part of the pelvic diaphragm, together with the obturator internus muscle over here. So this is just to show the pelvic floor. So all these muscles here are making up the pelvic floor. We can talk about the levator ani muscles, okay? This is the anus or the anorectal hiatus. And then we call it hiatus because this is a muscle and there is an opening in it. And then this is the hiatus for the urethra, where the urine will pass. Okay. And then if this is a male, you can see that it's more of heart shape. So this will be the hiatus for the deep dorsal fin. And one beautiful thing you have to also know is that the anorectal hiatus is far away from the hiatus of the urethra. So when this is presented to you, you can know that this is the male pelvis instead of the female pelvis. So we are trying to show from the top, superiorly, the puborectalis muscle or the puborectalis. That one will be around. So from the pubis, and then coming also this muscle here is the puborectalis, while this is the pubococcygeus because it goes to the coccyx. And then this big one we see is coming from the ilium to the coccyx. So we call it the iliococcygeus muscle. And all these are part of the diaphragm, the pelvic diaphragm. So we can see this because we've taken all the viscera, that's the ovary, the diaphragm, the whatever, the penis and everything out of here. Did I mention penis? Penis is below this, sorry. So this is this. Now, when we look at this, you can see the angle here. So it tells you this is more of a female, okay? And you can see the oval shape. So this is the oval shape. You can see the rectum and then the vagina over here. And then this is the urethra. And then we can also have the dorsal vein of the clitoris. That is why the clitoris plays the same function as the penis when it comes to the female urine or the female reproductive system. So also looking at the iliococcygeus muscle, and then we can talk about the puborectalis muscle around this area. And then we can talk pubococcygeus muscle, pubococcygeus muscle. So these are all muscles that will make up the diaphragm of the female pelvic floor. So we are trying to see the lateral wall of the pelvis. We are looking at the lateral side, how it will look like. So we've already talked about this, so I'm not going to talk much on this. So this is the medial view. When we cut the sacrum, you see we cut the sacrum in half. So when we cut the sacrum in half and we project through the medial view, if this was not cut, the other pubic bone will cover here. We can't see it laterally. So now we can see this, which is the obturator internus muscle. And then this is the arc of the spine. And then this is the pelvic diaphragm actually forming the floor of the pelvic cavity. You can also look at the piriformis muscle. This is the coccygeus muscle. This is the iliococcygeus part of the levator ani muscle. This is the pubococcygeus part of the levator ani muscle. And then we can't really or muchly see the pubocorectal muscle here because that will be down where the rectum is. So the levator ani, as we said, they are actually made up of the, when we say levator ani, do you know why we call it levator ani? Who can tell me? Who can tell me why we call it levator ani muscle? Oh, nobody. You see, when you sit down, you can move your anus up and down. Or where you can actually cause the movement in your anus. That muscle that is causing it to move up and down is what we call the levator ani. It will elevate the anus. That is why we call it levator ani. Do we understand that? Do we get that? Hello?
Yes, sir.
Okay. Now let me continue. So collectively, the levator ani muscle will run from the body of the pubis, the tendinous arc of the obturator fascia and the iliac spine, all the way to the coccyx. Okay, so that will be how they run. And mostly they are innervated by the inferior anal nerve or the rectal nerve, and then the coccygeal plexus. So this is just to show us the pelvic floor. Below it, this is a female one. We are showing one half. And this is the anus. This is the vagina itself. And then the anus is down here. So when you look at this can be divided into two. The whole pelvic cavity can be divided into two from the perineal body. This is the perineal body. And then this is the clitoris. The same way the penis form, that's how the clitoris form. When I'm teaching embryology, that one I'll do it in class. I'll show you how the penis forms and then how the clitoris form, and then you see that it's almost the same thing. So the muscles this muscle that you see, it's actually one muscle that comes to form something we call the inguinal process. By here, it is forming an ischiocavernous muscle. We also have that muscle. And then this is the bulbous spongiosus muscle, or the bulbous spongiosus. You don't have to say, as far as you call it bulbous spongiosus, it's a muscle. And then this is the perineal body. So from this spine to this spine, through the perineal body, all the way to the suspensory ligament here, it forms a triangle. You can see there is a triangle. And this is what we call the perineal triangle. And then we have the anal triangle also down there. So we'll be looking at all this very soon. These muscles, I will not talk so much about them. We can just read it. The coccygeus muscle, know its point of origination and insertion, and then what they do when it comes to pelvic activity in the body. Now, what can we see in the pelvic cavity? So we can see the urinary organs in the pelvis, ureters. So urinary organ, ureters, bladder, and then these are the main things. So all these things that we see here will actually belong or be found in the pelvic cavity, except the kidney. The kidney is a bit above. Okay, so we don't see the kidneys in the pelvic cavity. However, the kidney is a retroperitoneal organ. So we say the urethra, the bladder. So here, this part, all down. That is what we can see in the pelvic cavity. So this is the bladder. So when it is full, when it is empty, it's down like this. But when it is full, it pushes up. So this is why normally during pregnancy, you realize that your pregnant wife or your girlfriend that you have decided to impregnate will tend to urinate quickly. This is because on top of, superior to the bladder, we have the uterus. Superior to the bladder, we have the uterus. And then this uterus is also expanding. Now, as the uterus is expanding, it will put pressure on the inferior bladder below it. So the least amount of urine that comes into the bladder, it gives that sensational pull from the trigone as what you are feeling to go and urinate. Similar thing happens to the urethra, the rectum, which is behind here. The uterus will also push towards it. So you realize that pregnant women, either they are urinating frequently or they are visiting the washroom frequently. So this is just to show us the bladder, which is having the urethra coming in, and which is connected by the median umbilical ligament. And this thing that we see here is the trigone. And that trigone is the sensitive part that allows for you to know whether you are feeling to urinate or not. So within the bladder, we can see the trigone, which we've already seen when we're doing the excretory system. So I'm not going to talk much about it. So these are the detrusor muscles with the transitional epithelium inside. And this is the internal orifice of the urethra or the bladder. So eventually, this is what I'm talking about. This is the bladder. And then that comes out. So the female, they have actually 3 holes there. They don't have 2. Do we have any female on the in the lecture room? Hello, any female around?
Yes, sir.
Good. Have you tried looking down there to see how many holes you have there?
Not really, sir.
Not really. Who has tried? Who has tried? When you go today, go and take a mirror. Lie down. Then what? Abduct your thighs, okay? And then try and then use a mirror. Whilst you abduct your thigh, use a mirror, face a mirror, and then try to open the labia majora a bit. And then you see the number of holes you have there. You have the most anterior one, which is very small, which we call the urethra or the urethral orifice. Before we have the main vagina, then we have the anus here. So these ones are in the perineum, the perineal triangle, and this one is in the anal triangle. Now the other thing is that when you realize that your boyfriend doesn't know the hole, you have to direct him so that he doesn't mistake this one for this one. He doesn't mistake the urethra for the vaginal opening. However, the guys too, I know they are experienced in that, so they are able to find their way around. So this is the uterus, that's the womb. You can see how it lies over the urinary bladder. Hence, when it is expanding, it is putting pressure on all these things here. That is how come pregnant women tend to urinate frequently or go to the washroom to ease themselves frequently. Now, what we can see here is that this is the ovary. So this is the top of the sacrum. So we call it the sacral promontory. So from this sacral promontory, from here all the way here, from here all the way to this side is what we call the true, and coming down is the true pelvis, and anything above it is the false pelvis. So you can look at this diagram more and then try to study a lot on it. So they are just trying to show us the difference between the male and then the female bladder. The male and then the female bladder. All that we have to know is that the prostate, okay, the prostate gland is there. So the ligament that connects the pubic of the coccyx to the urinary side is known as the puboprostatic ligament. However, this one is coming from the vesicle, seminal, sorry, not seminal vesicle, the vesicle around here, so we call it the pubovesical ligament. Go and also look out for the essence of the deep perineal pouch in the, or the perineal pouch in the female reproductive system. One thing we also have to know is that innervations to the bladder is by the autonomic nervous system. Usually the parasympathetic nervous system gives direct input to the detrusor muscles, while the sympathetic is coming from 12 thoracic vertebrae and then L1 and L2 lumbar vertebrae. The urethra, they are just channels that connect the urine from the kidney to the urinary bladder. So, and they are under the control of the somatic nerves from the S2 to S4. Somatic nerves from the S2 to S4. Go and tell me, go and explain why the external sphincter is from somatic nerves, while the internal sphincter is from the autonomic nerves. I want to know that. Please go and look out for that. So this is the female urethra. This is the, in front of the urethra, we have the external urethral sphincter. And within that, we see the deep perineal pouch. You can see the paraurethral gland, the glans critoris, and then we have the external urethral orifice. So this is just to show a one-side view of the female urethra. So this is just to show the entire length, which is about 3 to 4 centimeters of the urethra. Now we are looking at the urethra. Okay, the urethra. So this is the urethra from the bladder to the outside. That's the urethra. But from the kidney to the bladder is urethra. Okay. So this is just to show the anatomy, how these fat cells are here to hold these things in place. So at times when you exercise too much and these fats burn, and then there is but one beautiful thing is that the ligamentum arrangements here are so thick that they prevent the dissociation of substances in the pelvic cavity. But for the male urethra, it is a bit long, and then it is made up of 3 parts. We have the prostatic urethra, we have the membranous urethra, and then we have the penile urethra. So this is just to show this. I think we've seen this severally. So showing us the true pelvis and the contents. That's the true pelvis and the content in the female. Now, rectum. So there's a lot in the pelvic cavity. Now, before I continue, so today's anatomy that we are learning, what type of anatomy is it? Is this systemic anatomy or regional anatomy? Hello? Yeah, hello? Yeah, I'm listening.
This I think it's regional.
Eh?
Regional.
You said?
Regional.
Regional anatomy. Beautiful. Regional. Because we are looking at one region, that is the pelvic region, and we are studying all the systems within the region. Do you get to know that that is what we are doing?
Yes, sir.
So that's what we are doing. So regional anatomy is a bit complicated, and that is what we treat in the medical school. But for you, I try to go systemic anatomy, and then we know we are in this system, we deal with it, and then that is fine. But for pelvic, which is very necessary, because a lot of infections are there, and as biomedical scientists, you may one day or would want to take samples from there. So it is very, very prudent that you know the pelvic cavity. Now, another serious structure we can see when it comes to the pelvic girdle is the rectum, where your undigested fecal matter is stored and then ejected. So the rectum is also very, very essential when it comes to the pelvic system. So at times, I'm going to teach you something. We will see. Do you see that? Can you see the picture here? When you take the female urethra or the pelvic, there is a time during genetic or let me say congenital abnormality. During the formation of a baby, you could have the walls of the rectum and then the vagina not dividing well. So there is a fusion between the vagina and then the rectum. And then that has a very beautiful embryological term and defect. I would want you to go and find out and look at study the embryology that leads to the damaging or that effect. Because when that happens, you intend to find fecal matter passing through that particular female's vagina. That is going to be annoying, right? The females, what do you think?
Very, very annoying.
Seeing fecal matter passing through your vagina. Is that no? And the males, what do you think? Would you want to enjoy such a vagina? No. What do you think? Hey, is Chronicles there?
Hello, sir.
Yeah, are you there?
Yes, sir. I was
So
having
would you want
network
to
challenge.
enjoy such thing?
No, sir.
You want the one that has been segregated. Is that not so?
Yes, sir.
Good. So you see, so when you come out well, when you are formed well, you know, I'm just trying that the last time I will meet you for anatomy is going to be embryology throughout. And you see the essence. I can only teach you about 5% of embryology. Okay, but I'm going to teach one that you get to understand. Anomalies. Okay. So we'll look at that next week, or even maybe in course of this week. So what happens is that I don't want to teach that I'll teach that a part in class, but I also do it online, so that when I come to class, it will be more of questions. Do you understand? So if you come out well, you should be very grateful to God, because there are a lot of anomalies that go on that we eventually do not know. Okay, someone can be born without head. They are all mechanisms that are in place that leads to this. So when you study anatomy, anatomy exposes you to all this understanding as a health professional. So this is just to show the rectum, and then this is the anus. The anus is just a canal. So the anal canal. You see how tightly closed is it? Okay, and then instead of going for soft, succulent vagina, and you would want to go for, how do we call it? This anus that is tightly closed. I learned they say because it is tight, it makes sensation more. But the question I want to ask, I don't get is that, do they know how their penis is swimming in the fecal matter? That I don't know what they do afterwards. That is why a lot of this genital infections are becoming more of these days. You may go and meet a man, you want to have one-time conjunction with this man, and you don't know the man is what? A gay, or maybe not a gay, but sleeps both at anus and vagina, and then he comes to introduce that into your vagina. These are some of the things that is why you will need to study your boyfriend or your girlfriend very well to know their activities, because the way the earth is running, the right direction of how the earth is running is becoming some way nowadays. So this is just to show the division. So this is the sigmoid colon, which is now coming to the rectum, and then all this part, and this is the anus. So what we are studying here is just the divisions of the parts, and then precisely the anatomical point, and then the surgical point. So this is normally where we dissect, and then this is the anatomical, the anodem. Okay, these things are all here, and these things actually increase sensation during anal intercourse, which is very stupid anyway. Perineum. I've given you a lot about perineum. So perineum is just the inferior border to the outlet of the pelvis, and then perineum actually is separate from the pelvic by the pelvic diaphragm. So it's just like let's try something. I can't see you, you can't see me. I would want to show a video of myself, but I don't want to do it because my face is not looking well. So it's just like forming your hand. Okay, let me direct this thing somewhere so that I don't want my face to show, so I can use my finger to demonstrate that. So you'll see, can you see my hand? Can you see?
Yes, sir.
Now, when you see it, that is my hand becomes the pelvic diaphragm. So anything below the pelvic diaphragm becomes the perineum, and anything above it on top is the pelvic cavity. Do we understand? So the pelvic floor actually forms the border or the boundary between the perineum and then the pelvic cavity. Do we get that? Do we get that? Hello? Do we get that?
Yeah.
Okay. So now let me continue. So now that I've spoken a lot about the perineum, I'm just moving straight. I'm not talking about the boundaries because I spoke about the boundaries and everything already. So when you get the slides, you can actually go through the boundaries. Now, when I was looking at the perineum earlier, I told you that looking at how between the perineal body and then the spine of the pubics and then the upper part, it forms a triangle. So there are two triangles that we always see in the perineum. We call them the perineal triangles. Sorry. We have the anal triangle and then the urogenital triangle. The urogenital triangle. The anal triangle is also known as the posterior triangle, which contains mainly the anus. And then the urogenital triangle contains the root of the scrotum, the penis in males, and then the external genitalia in the females. So the perineal membrane stretches between the two sides of the pubic arc and covers the anterior part of the outlet. And the perineal body is an irregular fibromuscular mass located between the anus and the perineal membrane. So at times, the females, when you put your hand between the vagina and then the anus, you feel some thickening, same as the men. That particular thickening is what we call the perineal body. So looking at the triangle, today we'll be seeing things, don't worry. Let's see the things. So this is let's assume this is a chronicles, and then this is the scrotal sac of chronicles. So chronicles has actually lie down in the supine position and abduct the thighs. So this is how the perineal region of chronicles would look like. So this is the perineal body will be here, and these are the pubic arcs, so the ischium or the ischial tuberosity. So this is the first triangle, this is the urogenital triangle, and then this is the anal triangle. So within the urogenital triangle, we will see the bodies of the perineal substance, as we say. You'll see the where am I? Yes, the root of the scrotum and then the penis. That's what I was trying to show you here. So this is the root of the scrotum, and then the root of the penis also begins over there. And then for the anal triangle, what we mostly see there is the anus. So this is the perineal body, as I said, between the vagina and then the perineum, the anus. And what we are seeing here, we call it the superficial transverse spine, which contains a muscle. We've looked at the bulbus spongiosus already, and then the ischiocavernosus muscle. So this muscle, the reason why the penis can be so hard, you know, and you wonder why it doesn't cut off, is that's not the beginning of the penis, is not the beginning of the muscle. The muscle actually begins from the inside, all from here before it comes out. We'll look at it. So it just continues the same way into the clitoris. So it's the same thing we'll see in the male. But just like in the male, the urethra also goes to join to form part of this. So there's another muscle that comes to form around here, which we call the corpus spongiosum. The corpus spongiosum. But these are the cavernosa muscles. These are the cavernosa muscles. So everything we have in men, we have in females. So this is just to show the perineal membrane, which is actually at the pelvic floor. Okay. So this is the pubic symphysis. So this is the inferior pubic ligament. And then this is the perineal membrane. So looking at the perineum of a female, we should think about, you can see this is a clitoris. Men, when I know most of you enjoy sex. This is the labia majora. This clitoris is the most one of the most sensitive parts for the females. Okay, and then this most sensitive part of the female is actually coming from this muscle, and it also has a lot of nerves in there. So this is the urogenital triangle, and this is the penile triangle, and then this is the perineal membrane. So the perineal membrane is more seen in the urogenital triangle, and this what we are seeing here is the root of the external genitalia, and this is actually the labia majora. But in female, in the male, can you see this is the cavernosa muscle? They continue to form the corpus cavernosum, whilst this one, that's the root of the external genitalia, also continues together with this, and then it forms part of the penis, and that is why the penis is a bit bigger. Okay, and the cavernosa muscles also enlarges more. So if you want to make your penis bigger, you aim at the cavernosa muscles. Okay, and this is the glans penis, which is the most sensitive part when it comes to the male. So the analogous of what I was showing, this is the cavernosa, and then this is the penis. Okay, which is seen here, just that this is more extended outward. So I'm not going to talk about this. Make sure you read on them. Bulbus spongiosus muscle, ischiocavernosus muscle. When I ask you to read on a muscle or something, especially a muscle, you are supposed to know their point of origin and then point of insertion. So you try and look at this, and then you read more on it. You do not have much time. So this is just to show us more. So this is the main thing when you see it naturally. This is the vagina, and then you can see that in the orifice of the genitalia, this is the bulb of the vestibule. This is the labia majora, and then the minora is in there. So this is the urethra, and then this is the anus. So the clitoris is anterior to the urethra, which is also anterior to the vagina. So there are a lot of nibbies here when it comes to the female, especially in the urogenital triangle of females. So all that you have been saying, and then you get confused, is this plenty nyama thing. And this muscle here is the ischiocavernosa muscle. We call it ischiocavernosa because it's coming from the ischium. It's a skeletal muscle coming from the ischium, and then of the pubic bone, and then going all the way in there. So male, aside the muscle, which is very strong, we have a lot of ligaments that will hold the root over here so that it doesn't cut off or it doesn't fall. So one of them is the fundiform ligament of the penis, and then the suspensory ligament. We do not have the fundiform ligament when we come to the females, but we have the suspensory ligament of the clitoris. So the suspensory ligament makes it suspense, and then the fundiform holds it in there. And then these are just the bulbospongiosus muscles. So this is what is going to form the corpus spongiosum when we come to the male. So this is what we are actually showing over the bulbospongiosus muscle, forming the corpus spongiosum, and then the ischiocavernosa will come in to form the corpora cavernosa, and then we have the external spermatic fascia, and then its muscle inside there. Well, there are a lot to teach when it comes to this, but I'm just limiting us to this. So you also have to know the muscles within the perineum. You have to know the external and anal sphincter muscle, 8 points of origination and insertion, and then especially what nerve innervates. So when there is also a stimulation, what does that particular muscle do? So there's external anal sphincter. What do you think it will do? It's a sphincter, so it will close the anus. The internal anal sphincter is also a sphincter, it will close it. But what's the difference? One is what? Controlled by the autonomic nervous system, and then one is controlled by the somatic nervous system. So one is voluntary and the other is involuntary. That is how come you can voluntarily control fecal matter coming out of your anus. So this is to show the anal painting or the aperture. This is the rectum, and these are the pectinate lines. So within here we have the stratified squamous, non-keratinizing epithelia, and then aside this we have this 1, 2, 3. They will close the anus, and then they are actually the sphincter, which are made up of deep, superficial, and subcutaneous muscles. So these are just muscles, and then their origin, insertion, their action. So, and then put a nerve that supplies it. So this one I'm not going to talk about it. I'll just move through every 5 seconds. So now we looked at the superficial transverse muscle. So we talked about we saw the external external and internal anal sphincters, superficial transverse muscle, and external urethral sphincter. So we are looking at the superficial transverse muscle, perineal muscle. So this whole thing, these are the superficial transverse perineal muscles. All these muscles together with the perineum membrane. All these muscles that you see there, okay, they are superficial perineal muscles. So this is just for you to look more at and see how you enjoy it. Deep transverse perineal muscles. So when we say superficial, especially when you open your thighs, when you take off the skin, the very first substances muscle you see, they are the superficial. Now when you remove the top muscles, what you see down becomes the deep muscles. So these are the deep transverse perineal muscles. So we can talk about deep transverse perineal muscles over here. So when I go back here, these are the deep transverse perineal muscle. Below this one, we'll have the deep. Okay, so these are actually superficial, but below them too, we have the deep. So you may not know depending on the depth of view. Now, what this M and F you see here, we are talking about female, male, female, male. So this is a male. Is this a male or female? Then this thing is off. So we are looking at the clitoris. This is the cruise of the clitoris. This is the urethra, and this is the vagina. You see how big the vagina is and loose. So it can accommodate anything that passes through it. Okay. Now, when you take out these bulbs of the vestibule, you can see the deep transverse perineal muscle. But on top of this perineal membrane, you will see the superficial perineal muscle. So just showing pictures. So you are looking at the vagina, the urethra, and then these are all the external genitalia. This is the labia majora, and then the minora inside here. Okay, and then nonetheless, this doesn't show the total representation of a female's perineal region. Depending on the shape of the vagina, we have different types of vagina. Some of them are very open, some are very small. Also, the shapes also look a bit different. Then this is the frenulum, and then here we call the perineal raphe. Okay, at times when delivery is becoming too difficult, we cut the perineal substance here and to allow for the baby to come out, especially when the baby's head is so big. But this is just to show an overview of the superficial perineum of the female. And this is for the male. Now from the perineum is different from the peritoneum. When we do the abdomen, I will touch more on the peritoneum. So we'll talk about the peritoneum. So anything above the pelvic cavity, at the abdominal cavity, okay, that within the abdominal cavity, we have a fold of what? I think when we're doing GIT anatomy, I explained that, so you can go and look at it. But when we are doing the abdominal abdomen, we will talk more on that. I think I've even treated that already. So this is the pelvic and the peritoneum. So this is just to show any substance above here becomes a peritoneum. So within the peritoneum, you are going to see all the other structures. And this is the pelvic, but this is the peritoneum that forms the upper. So that one, it contains the liver all the way to down, where you have the floor, which is formed by the levator inner muscles. So below the levator inner muscles, then you now have the pelvic cavity. The perineum. So that makes it for today. Any questions? Any questions? Because I have to get going. Any questions? Hello? Any questions? Okay, so if there are no questions, I'm sure maybe the network is a bit disturbing. Thank you very much for today's section of lecture. And then we will continue in course of the week, either today evening or tomorrow morning, to finish up the whole reproductive system at once, together with the histology. Thank you very much and have a wonderful day.